Emirates Cardiac Society has launched its congenital heart disease awareness campaign here in the UAE. The disease is one of the most common birth defects, with numbers increasing as the world population rises. Consultant cardiologist Dr. GhadeeraDubaiONe joins us here in the studio to update us on the latest advances in the condition. Dr. Al-Mansouri, great to have you with us. Thanks for joining us.
Thank you very much. Great to be here.
Can you first of all just explain to us a little bit about congenital heart disease?
Congenital heart disease is a common birth defect which affects the heart and the structure of the heart. It happens to 1 in 100 live birth of every almost internationally and globally. We have our very sizable numbers of either young adults or adults with congenital heart defects in United Arab Emirates. And this campaign is an initiative from the Emirates Cardiac Society to increase awareness of both the community and the medical community of congenital heart disease.
We'll talk more about the campaign in just a moment, but how common is the condition here in the UAE?
As I mentioned, it's 1 in 100 of every birth, of every 100 live birth in United Arab Emirates. We don't have exact numbers of the current numbers of patients with heart defects, but I can assure you that we are seeing more and more of those patients, especially when they are transitioning from the pediatric age group to youth and adulthood.
Does it affect more men than women or more women than men?
Generally, it affects both genders, but there are some increased numbers of certain defects in women rather than men, or vice versa.
Could you tell us then a little bit more about the Congenital Heart Disease Awareness Campaign and how people can find out more about it?
I'm very thankful to being a member and being the chair of the Congenital Working Group in Emirates Cardiac Society, and I'm very thankful to the Emirates Cardiac Society for their initiative. This is the first campaign of congenital heart defects in United Arab Emirates, and it's inclusive of both adults and pediatric, the youngster and the young age group. And it's basically was to increase the awareness of our community, our society, and our colleagues in the cardiology and in the medical field. It has it was launched in February of 2023, and it has included lectures, conferences, radio interviews, and TV interviews. Hence, I'm here today.
Great to have you with us. Dr. Al-Mansouri, what challenges do patients face throughout their life with this condition?
This is a very interesting and very important questions. Challenges, the main challenge that the patient is facing is access to care, and where to go, especially where to go once the diagnosis is done or made, and where to go when the diagnosis requires intervention or surgery. And another challenge is the knowledge and the insightful knowledge of the patient and their families and caregivers that it's a lifelong condition requiring lifelong care.
How regularly should people with the condition go and see their specialist or a doctor?
So people who are born with congenital heart defects, they need more intense care during their early years, and then a regular and lifelong care with an adult congenital heart disease specialist. And there are guidelines and clinical requirement when the patient should go and see, but there are very clear guidelines. And I'm very happy to say that we started for the last 3 to 5 years. There is a network of colleagues and clinics providing highly specialized care in congenital heart disease.
Is awareness of the condition improving, do you think?
I do believe so. I do believe that there are awareness from our colleagues to refer their patients to a specialized care and specialized clinic. There is a self-referral and awareness of the community and the families to seek specialized medical attention in the congenital heart care, and to extend and transition their loved ones, especially the sons or the daughters, to a specialized consultant in congenital heart disease.
We wish you a lot of luck with the latest campaign. Thank you very much for coming in
very much
and speaking with us, Dr. Ghadeera Al-Mansouri.
Thank you very much.